Hello, everyone. This is Mayur. I'm part of the Zenman Health team. We are kicking off our new monthly series of webinars. And I've got a special guest here, Dr. Galina, with us. She is going to educate us on H. pylori. And we are not here to sell you anything. This is purely educational. And we're going to put a disclaimer up that this is not medical advice by any means. So Dr. Galina, please take it away. Thank you.
Yeah, hi, I'm so my official name is Dr. Galina Malas, but I just go by Dr. Galina with all my patients. And I am a naturopathic doctor, which ultimately means that my goal is to get to the root cause of illness and treat it naturally through supplementation, diet, and lifestyle changes. And so as it says here, I'm also a doctor of functional medicine, which is the branch of medicine that deals with root cause medicine. I practice out of Chicago, and I also do telehealth, and that's just kind of a rundown of, my education and experience right here. Okay. And so then these are disclaimers, obviously. I have no affiliation with Zenman, and then, this webinar is not intended to diagnose, treat, or cure or prevent any disease, and always speak to your medical provider ultimately. And, prior to purchasing, we're going to talk about some Zenman supplements here. So if you at some point are interested in purchasing them, obviously talk to your physician and follow, recommended dosage instructions. Okay, so we're going to talk about H. pylori. When it comes to gut stuff, it's probably my favorite thing to talk about, just because I see so much of it with every, gut patient that comes into my practice. Somehow H. pylori always comes up. And, for such a problematic little bacteria, it's kind of pretty looking, isn't it? It's really like fancy and colorful, and but really causes a lot of trouble ultimately. So what is it? So let's give a quick intro. H. pylori stands for Helicobacter pylori, and it's bacteria that can cause infection in the stomach or the duodenum, which is the first part of the small intestine. So when we look at your GI tract, right, we have, you eat the food, right, that goes down your esophagus and into the stomach. And then the next part of the stomach is connected to that small intestine. So that's where the H. pylori can live, in the stomach and that first area of the small intestine. It is the most common cause of peptic ulcer disease. So, when you hear a person saying, I have an ulcer, oftentimes, you'll hear someone say, I have a stress ulcer. That's usually due to this bacteria, ultimately the H. pylori. So what it does, it can inflame and irritate the stomach lining, which is also known as gastritis. It also, interestingly enough, reduces stomach acid, which, it's a myth that, stomach acid is bad. And, most people think when they have acid reflux, it's due to too much stomach acid, but it's actually usually due to too little stomach acid. Stomach acid is important, actually. And when you don't have enough of it, it creates a breeding ground for bacteria like H. pylori. So if untreated, chronic H. pylori can lead to stomach cancer, but that is a rare occurrence. More often than not, it just leads to acid reflux and GERD. So H. pylori is actually present in, the range is anywhere between 50 to 75% of the world's population. Now, granted, a lot of that comes from third world country type of population. But also there's so much H. pylori present in the North America, I would say. Like I said, again, this is not an exact statistic, but 9 out of 10 gut patients that come into my practice have H. pylori. So I definitely see a lot of it. Usually it doesn't cause severe illness in most people, but usually digestive discomfort and systemic symptoms do appear if it's allowed to overgrow. And again, it's not unusual for it to be asymptomatic. So you might have H. pylori without ever knowing that you have it, unless you were tested for it. Okay. So this is just another little picture that basically gives a nice little summary of H. pylori, right? So the H. pylori lives right here in the lower part of your stomach and beginning of your small intestine, right? So this infection causes inflammation. in the lining of your stomach and small intestine. And ultimately that inflammation can then create an ulcer situation, either in the duodenum or in the stomach itself. And that can definitely bleed and cause, other kinds of complications. So that's kind of worst case scenario. So is H. pylori infectious? Yes, very, very infectious. That's why I really like this little thing that I found. It says sneaky and persistent H. pylori. It's exactly what it is. Once a person in a family has H. pylori, it's almost a given that the other family members will have it as well. It's very easily spread from person to person. The bacteria is found in saliva, in teeth, plaque, and in stool. And that's why we're going to talk about it in a minute, but we do stool testing to assess for H. pylori. It's usually acquired through food or through kissing. So it can be spread through kissing and through poor bathroom hygiene as well. What we call kind of fecal oral contamination as well. And scientists actually think it might be spread through H. pylori contaminated water and food. And that goes back to also hygiene, I guess, to a certain extent. And like I said, usually if one person has it, they will almost always have other family members with it as well. So like this little graph here shows, what are the risk factors for getting H. pylori? Infected family members, crowded living conditions, so hygiene, poor hygiene, number of siblings or number of family members in general, poor sanitation, fecal contamination of water supply, and then also if you're a healthcare professional, you're easily exposed to H. pylori. Okay, so what are some of the symptoms of H. pylori? They're pretty widespread. Most of them have to do with the digestive tract, but some of them are systemic symptoms. So we have obviously heartburn. That's the most common H. pylori symptom, or that could, the heartburn could turn into more of like a reflux GERD situation as well. Stomach discomfort or pain, bad taste or odor in the mouth, sensation of fullness in your stomach, even when you haven't eaten a lot, also bloating as well, decreased appetite. I guess that goes hand in hand with the sensation of fullness, as well as constipation. Not so much diarrhea. People with H. pylori definitely tend more towards constipation. Usually nausea without the vomiting, some indigestion and belching, bleeding gums, interestingly enough, as well. And then some systemic symptoms, such as insomnia, having difficulty sleeping, because basically something in your stomach is bothering you, right? Anxiety as well, fatigue and brain fog. Those are some common systemic symptoms of any bacterial overgrowth, but especially the H. pylori. And so something interesting is also the symptoms of H. pylori in children can manifest even a little more systemically than in adults. So, you can still have that stomach pain and the nausea, but then in children, it could also manifest as difficulty focusing, fatigue or depression, and basically, unable to attend school because of all the symptoms related to the H. pylori. So testing for H. pylori, there's ultimately 4 ways to test for it. Through an endoscopic exam, that's an endoscopy when they put a tube down your esophagus to see, and with a little camera to see what's going on, and potentially take some samples. You could do a blood test, you could do a breath test as well, or you could do stool testing for H. pylori. Now, 3 out of these 4 are less reliable than the other. So an endoscopy oftentimes misses the H. pylori actually. The breath test really only picks up acute H. pylori versus a more of a chronic infection. And then the blood test really only measures the antibodies, the antigens created for the H. pylori, and those, with time become less and less and may not be picked up in the blood work. The only true and most accurate measurement of H. pylori is through stool antigen testing. So my favorite stool test, and again, I'm not in no way affiliated with the GI map. It's just what I use in my practice day in and day out. So it's the GI map by Diagnostic Solutions, and it's probably the most comprehensive stool test out on the market. And I've tried all of them, and over the years with my patients, and I've come to the conclusion that in terms of H. pylori, especially GI map is the best at picking it up. And basically, as it says here, one of the indications for doing this test is for individuals with suspected H. pylori infection, among other digestive, issues. And so what I really like about this test, it also measures for something called H. pylori virulence factors, which are basically genetic factors that the H. pylori exhibits that can influence the way they're expressed systemically, can influence the way your H. pylori presents in terms of symptoms and side effects, right? So for example, this BAB-A1 could create inflammation and promote long-term infection if you're positive for this virulence factor. This virulence factor right here, can make you more prone to having that cancer or ulcer situation, which are the worst case scenarios when it comes to H. pylori. And then, a bunch of them promote inflammation. And then also here, this one even damages the mitochondria. So, which is that kind of center, that hub of your cell. So this impacts even on a cellular level, right? On the metabolic level. So H. pylori outside of gut symptoms can definitely present with a variety of systemic issues as well. Okay. So treatment of H. pylori. So there's a few ways to treat it. So the pharmaceutical treatment of H. pylori is pretty standard. The Pref-Pak, that's the most common kind of standard of care for H. pylori. If you go to a gastroenterologist, it's basically triple treatment. It's a combination of amoxicillin, clarithromycin, and Prevacid, which is an antacid, for 14 days. So that's the Pref-Pak right here. You do it AM and PM for 14 days. There's other combinations as well, other antibiotics that are used, including metronidazole and tetracycline, or other acid reducers as well. But it's usually a combination of antibiotic and an acid reducer. So that's your pharmaceutical treatment of H. pylori. Whether you're doing so when you're doing a pharmaceutical treatment, the problem is that H. pylori can become resistant to treatment. Okay, first of all, H. pylori can be persistent if not addressed properly, but it could also be resistant to treatment. And as it says here, antibiotic resistance has led to poor treatment success with traditional triple therapy, which is what I just talked about. So what I really like is it says here, recent advances in H. pylori therapy, they've started, looking elsewhere and seeing how else H. pylori can be treated, both, on a pharmaceutical level, even on a genetic level. And also, they mention here supplements and probiotics and vitamins. So it's really nice to see that the medical field has started branching out in terms of H. pylori treatment. So, but no matter what route you go for H. pylori treatment, diet and nutrition are a huge part of it, whether you're doing the pharmaceutical route or the natural route, which we'll talk about next. So making the right diet choices in support of eradicating or healing from the H. pylori is extremely important, right? And so I always say, try the diet for about 2 months, or at the very least 2 months, to get maximum benefit from it. So, the first way is to do like a more of a healing diet, where you're eliminating certain triggering foods like gluten and dairy, which are inflammatory, and also rotating foods through your diet. And then the second way is to, do some lab testing to determine specific food allergies and sensitivities, presence of gluten intolerance and leaky gut. And again, so this is getting more into that functional medicine GI map testing that I do, and then following recommendations based on those findings. I also really like this little picture that shows different foods that actually help kill off the bacteria. So here, and this is unfortunately, this is not a great quality picture, but this is the best I could find for this specific one. But it shows green tea, broccoli sprouts, Nigella sativa, which is black cumin seed, cranberry juice, cabbage juice, and all kinds of berries. So, all of these have a variety of antioxidant, anti-inflammatory components, and bacterial killing components that can be very useful when going through an H. pylori protocol. So then let's talk about the natural treatment of H. pylori. So this is what I do day in and day out with my H. pylori patients. We do a combination of supplements, usually a combination of herbs and nutrients. Some of the most widely used and most effective herbs against H. pylori, something called mastigum, berberine, slippery elm, DGL, which is a form of licorice, and oil of oregano. So that's the herbs. Some of the nutrients are zinc, carnosine, and bismuth. And then I also like to use probiotics, sometimes at the same time as the antimicrobials, and sometimes after, like kind of in the second phase of treatment. But the probiotics always have to be multi-strain and high potency. So like in the billions, 25, 50 billion with many strains. I also like to use a variety of anti-inflammatory herbs, and there's so many options for that, just to calm down some of the inflammation that has been created by the overgrowth. Whereas this is killing off the overgrowth, this is just calming down the inflammation. And then also throwing in, usually in the second phase of the treatment, some GI repair supplements, including glutamine and certain herbs that help repair the gut lining, and just fix overall gut health. Okay, so I do want to highlight a couple of the Zenmen supplements that I think are really great for H. pylori. I've looked through all the ingredients, and it's a great combination. So the one that has really impressed me is actually called H. pylori Relief. And basically, it's, as it says here, an herbal blend containing Lactobacillus reuteri, which and it has 10 billion of it, and it's a really good probiotic that's beneficial in fighting off the H. pylori. And it also contains a lot of those herbs and nutrients that I mentioned in the previous slide: the zinc, the mastigum, the berberine, the licorice, and a whole bunch more. So it's best for addressing discomfort brought about by a stomach ulcer if it's gotten to that point, or it's helpful in killing off the H. pylori, and obviously to help manage the bloating associated with it and other symptoms as well. There's also some other really great ingredients in there: broccoli sprouts, green tea. These are the two things I actually also mentioned on the previous slide in terms of the foods. So it comes in supplement form, and also cat's claw, which is just a great herb in supporting digestive health and getting rid of inflammation and balancing the good and the bad microorganisms. And then so the recommended dose is 2 capsules daily. And it's always good to combine it. The H. pylori treatment is always good to combine with either an immune boosting supplement, or actually, I really like this one, the Zenmen Cruciferous Superfoods supplement, which is, this is it right here. And so it's basically a combination of ingredients sourced from vegetables, cruciferous vegetables specifically, and probiotics. It also contains some great liver supporting herbs like millet thistle. It's also got saw palmetto, pumpkin seed, and tomato, so full of antioxidants as well. It's great for digestive health and for bloating when it comes to the H. pylori, and it really works well together with the H. pylori, any H. pylori supplement. It'll also help boost energy, support the immune system, and detox the liver, which are all important aspects of any H. pylori protocol. And maybe I'll let Zenmen take over and kind of talk to you about this giveaway here, if you want to do that.
Sure, thank you, appreciate it, Dr. Galina. We would like to give away a free cruciferous bottle to all the participants. If you just send us an email to info@zenmenhealth.com, and we will also enter your name in a drawing to get a free H. pylori relief supplement as well. The cruciferous is free, and 10 lucky attendees will get a sample of our H. pylori supplement as well.
Amazing. The formulas are great, so it's very exciting that you're doing that.
Yes, thank you.
And then if you have any questions, I can take some questions now, or if you think of any questions later. And for those who are watching this, the recording later, here is my email if you have any questions to ask.
Thank you once again, Dr. Galina. This was great. So if you please feel free to ask questions. And as we pointed out earlier, that this session is being recorded, so the recording will be made available. But at the same time, this is not medical advice. So this is just a generic discussion around H. pylori / gut-related issues. And we want to make this as educational as possible. So we have access to a board-certified naturopathic doctor here. So let's make the most of it.
Oh, there's a question in the chat box, actually. Let's see. Can H. pylori be considered an autoimmune disease? No, definitely not. It's just a bacterial overgrowth. An autoimmune disease is more when certain things are happening in your body, especially with your immune system, that's causing it to attack its own tissues, its own systems, basically. Some like that happens with like thyroid often, it happens with things like arthritis. You may have heard of lupus. Those are like the real serious autoimmune diseases. H. pylori is a disease of basically overgrowth of a bacteria that shouldn't be there. And it's extremely common. And so, it might sound like an unusual question, actually, but it's not. I've actually had patients ask me that before. In general, if gut overgrowth has anything to do with autoimmunity. Autoimmunity can predispose you to gut overgrowth, actually, so ultimately to H. pylori, but it in itself is not an autoimmune disease. Okay, so the next question was, what happens if antibiotics don't work for H. pylori? So that actually happens a lot. Again, like that one slide that I showed, right? How can I go back? Okay, I'm not sure. Anyways, the one slide that I showed that H. pylori is becoming resistant to antibiotics, right? Oftentimes antibiotics don't work for H. pylori, and the GI map test actually runs a panel at the end of it, showing if your H. pylori is resistant to certain antibiotics, which is really interesting. So to know which type of antibiotics to use off the bat. But usually what happens is, at least with my patients, they'll come to me after trying antibiotics, and why they don't work, it's either not the right combination, or there's other things going on under the surface that just will not make antibiotics effective. So that's when we try the natural treatment. Before you ever try antibiotics or after antibiotics, the natural treatment can always be implemented. Also, if it didn't work with antibiotics, maybe you weren't eating properly, and basically you were fueling the bacterial overgrowth. So even though you were trying to kill it off with antibiotics, you were giving reasons to the H. pylori to kind of stick around, right, with the foods that you were eating. Bacteria loves sugar. So, and it loves processed foods, and it loves all the kind of pro-inflammatory chemically foods. So sometimes that happens with, the wrong kind of diet as well. So again, we always change your diet. We make some, different diet and lifestyle choices, and we put you on a natural protocol. Let's see. So someone writes here, I have tried so many antibiotics and prescribed medications. This is my 6th time testing positive and nothing making it go away. I had an endoscopy and a colonoscopy, but they never took a sample. I don't know what else to do. Yeah. So I would say trying the natural route, especially if you've gone through so many rounds of antibiotics. The other thing that I would say is that really it's important to test for other overgrowth as well, outside of H. pylori, to see if there's any other issues with the microbiome, both in your large intestine and also in your small intestine. There's something called SIBO, and I often see it hand in hand with the H. pylori quite often. And SIBO is an acronym that stands for small intestinal bacterial overgrowth. So as a naturopathic doctor, these are all things I test for. I don't test for just H. pylori alone. And usually addressing, all the overgrowth has a lot greater impact on reducing, any of the overgrowth. I think that's all for the questions, unless anyone has any other questions. Oh, you're welcome. Absolutely. And as I said, if anyone thinks of any questions later, just you can send an email to staff@drgalinand.com, and I'd be happy to chat with you guys.
If there are no other questions, thank you once again to all the participants for your time. And once again, this was an amazing presentation, Dr. Galina. I think we all learned a lot. It was a lot of information in 30 minutes, but the good thing is this is recorded, and whoever wants access to it, we will make this available to them, and we will also put this up on our website too. And thank you very much for graciously offering to answering any questions if people have any follow-up questions too. So once
Absolutely. Have a good night, everybody.
thank you all. Take care.